Hematology is the study of blood and blood disorders. Hematologists and hematopathologists are highly trained healthcare providers. They specialize in diseases of the blood and blood components, including blood and bone marrow cells. Hematological tests can help diagnose anemia, infection, and hemophilia, as well as blood clotting disorders and leukemia. What is the difference between a hematologist and a hematopathologist? Well, a hematologist is often a medical doctor who is a board-certified internist or pediatrician who has completed additional years of training in hematology. A hematologist usually focuses on direct care of people, diagnosing and managing hematologic disease, including cancers of the blood and bone marrow. On the other hand, a hematopathologist is often a medical doctor who is board-certified in both anatomical and clinical pathology. They also have additional years of training in hematopathology. Hematopathology is the study of disease of the blood and bone marrow, and also the study of the organs and tissues that use blood cells to do their physiologic functions, such as the lymph nodes, spleen, thymus, and other lymphoid tissue. The hematopathologist focuses on diagnosing conditions of the hematopoietic and lymphocyte-rich tissues, often done by direct exam of tissue and blood in the lab. Common hematology tests include the complete blood count, or CBC, which comprises the white blood cell count, red blood cell count, platelet count, hematocrit red blood cell volume, and hemoglobin concentration, the oxygen-carrying protein in red blood cells. Other tests are differential white blood count and red blood cell indices, which help diagnose anemia, certain cancers of the blood, and inflammatory diseases, as well as to monitor blood loss and infection. The platelet count, often done as part of the CBC, is used to diagnose or monitor certain types of bleeding and clotting disorders. Prothrombin time, partial thromboplastin time, and the international normalized ratio are used to evaluate bleeding and clotting disorders and to monitor anticoagulation therapies. Although not a common test in general, the bone marrow biopsy is a common test for hematologists, involving the extraction of cells from the bone marrow for analysis for many types of diseases.